This is Eezy 107.5 FM.
Polar. It means there are two poles. And so like a pendulum, what we talked about last week was depression. Depression then is one pole of the mental illness spectrum. And what we said last week was that depression is a state where a person experiences profound sadness that lasts more than 2 weeks. And this person then gets into a situation where they are so depressed that they lose interest in life, they become hopeless, and feel this sense of hopelessness take over their lives. They withdraw from their loved ones, and this can even lead to suicidal ideation. So that's one end of the pole. The other end of the pole, which is what we're going to be talking about today, is schizophrenia. When we say the person has actually lost touch with reality. Ahumanate. Right now, the person is out of contact with reality. And so, unlike the depressed person who is withdrawn, melancholic, cannot even do things that used to bring them fun, the person who is schizophrenic is excitable, talks very fast, has a lot of ideas, and can even hear voices. So we're going to talk about the entire spectrum. But just like a pendulum, where you have one end being the depressed mood, and in this case schizophrenia, where you have the excited person, there is also a middle ground, which then becomes the person who has bipolar disorder. In other words, they can have episodes where they are very depressed and episodes where they are very excited. And the excitement part of it with the bipolar disease is what we call the mania part, the manic phase of the bipolar disorder. So the person who has bipolar disorder will have episodes where they're profoundly sad, lose interest in life, and become almost suicidal. This can go on for about over a month, and then they go into a phase where they have a lot of talkativeness, racing thoughts, inflated self-esteem, and they become very easily irritable and agitated. So they have both components, and these components can come in waves. One happens for about 2 weeks or more, and then they switch into the other phase, and it's called bipolar disorder. So that's very different from depression, because a depressed person is always calm, quiet, sad, and has lost interest in life. The bipolar person has both components. What are some of the causes of bipolar disorder? Well, since we are able to treat this condition also with medications, we believe there is some change in the chemistry of the brain. Of course, heredity may have some component to this as well. But most of the time we realize that stressful life events are usually associated with the initial development of bipolar disorders. And then, of course, certain drugs can become triggers. And this is very important to know this, that cocaine, amphetamines, alcohol can become triggers in the person who is already predisposed to developing this bipolar condition. In the manic phase, patients with bipolar disorder may be inexhaustibly, excessively, and impulsively involved in various pleasurable and high-risk behaviors. For example, gambling, dangerous sports, and they can even go on sexual sprees and shopping sprees, knowing very well that these are detrimental to their health because they don't have the insight to know the consequences when they are on these sprees. And God forbid they have a credit card or get a hold of your credit card, they will spend it above the limit and not even know the consequence. When this becomes very severe, then you get into the manic phase, and sometimes we call it manic psychosis. So you're moving gradually from the spectrum of depression, where the person is calm and quiet, to a stage where they have both components. They are sad and depressed one moment, or for a period of about a month, and then they switch into the manic phase, where they are excitable, talk very fast, and engage in dangerous activities. We can even get into the manic psychosis. Now, when we use the word psychosis, that's where they've lost touch with reality. That is the main difference. When you swing to that end of the pendulum, the person can start hearing voices when nobody else around them can hear these voices. They can have delusions. Delusions will be a condition where they see things and they imagine things that nobody else around them can even see. I had an experience as a young medical student walking into the room of a patient that we had just operated on and kept in the hospital for about 3 days. And as a young doctor, I walk into his room and he's crawled up at one end of his bed, a big tall guy. I asked him, "What's your problem today?" "Oh boy, I didn't sleep all night. There were elephants under my bed disturbing me." Elephants under your bed in the United States? That is a delusion. They have lost touch with reality and they start imagining things like that. And of course, the hearing of voices that nobody else around them can hear is the hallucination part of it. These people then lose the ability to reason properly. And you see, all these symptoms then affect them with their work. They are not able to function like they used to at the high level that they used to. So they end up losing their job. You go to their house, they are not able to maintain the house and keep things in order. There are cockroaches and ants crawling all over the place, and it's okay with them. So with this, they end up losing their loved ones and they become isolated. So you will find that in most cases, people will say, "Oh, it happens to poor people." No, they probably got into the poverty stage because they lost their jobs and they are usually lonely and isolated. Also because when the symptoms started, people didn't recognize that for what it was and moved away from them. And isolation then becomes a very powerful tool for the propagation and the continuation of this condition that has started. We're going to give you a lot of information about mental disorders today. But I want to make it very simple and let you understand that it's a spectrum. However, some people will go through life suffering from just the depression part of it, and some will go to the other end of this bipolar spectrum with the psychosis and the irritability, the ability to concentrate, the loss of touch with reality. That is where you say the person is mad. However, I don't want to use that word because it has that negative connotation, because when it comes to their treatment, they need love, they need understanding, they need compassion. Trying to wrestle them down, trying to beat them up and be violent to them does not solve the problem. They need a warm, kind environment to do well. So let's not just say that they are mad and write them off. We need a community environment to put them in. Group therapy. I've even had the fortunate circumstance of delivering a baby for 2 people, both psychotic, but on their medications, doing very well, as long as they stay on their medication. Getting married, and guess what? When I delivered the baby, it was perfectly normal baby. So it can be managed, and in some cases, they can be managed and treated to where they can have very productive lives. When we're going to take a break. When we come back, I'll delve a little bit more into schizophrenia, because last week we did justice to depression. So today, we'll spend a lot of time talking about schizophrenia, which is what a lot of people called about the last time. People who we call mad. And I'm going to tell you what causes it, how they can be managed, the treatment, and the outcomes. We'll take a short break and we'll be right back.
Hello? Aja, where are you? Okay. Boss, please, I'm looking for Citywide Enterprise. Some funeral needed. Oh, you go for Accra, see. Go straight, then pass right.
Ghana and Adation system.
4 houses, you will see.
Pass here.
Oh, I tell you.
By now, the digital one is going to help.
It will help, but people will have to be informed. They have to be educated. We want to know it and apply it.
I saw the rip going on between the current vice president and I read it and I laughed.
Honestly, see, once they politicize it, we lose the education aspect of it.
Exactly.
It's hard. If you take over me saying that means you are MPP, you take Bahamas on the air.
So we have to politicize everything.
Information is protected by the Data Protection Act 843.
What matters to you matters to us. Your health is our concern. Tune in to Eezy Consulting every Tuesday from 8 a.m. to 9
It's spending a call
You
here.
don't need to stress.
Because attention is there. 10% of money will grab straight.
In the middle, not in the
You want your money, you can relax.
55599. Just in case you miss it, tune in on Thursdays from 8 p.m. to 9 p.m. for a repeat. Eezy Consulting, where your health needs are met.
Your stress-free morning show with your medicine. Eezy.
Awesome. Thanks for tuning in this morning. We're in the Eezy FM 107.5, the consulting room, and I am Dr. Francis Dickson. We're today talking about a very, very important topic. Don't underestimate the depression part that we talked about earlier, because those are the ones that sometimes you don't see. We're all excited when we see the ones who have lost it and are naked in the streets. That's the schizophrenia. But the bipolar disorder is also very important, and the depression is also very important. The depression leads to quite a bit of suicide, and like I said last week, it can be very simply treated with medication and what we call talk therapy. Today we're dealing a little bit more with schizophrenia, and like I told you earlier, these people with schizophrenia have actually lost contact with reality. And it manifests itself in several ways. One of the primary areas that you see it manifests itself is false perceptions, where these people hear voices. And I told you that it's called hallucinations. And they have false beliefs. Some people can even believe that whilst they were sleeping, somebody came in and snatched all the organs in their body. You look at them, there's no scar, there's no cut, but they really believe this is true. Your goal is not to try to convince them that it didn't happen. You sympathize with them, show them love, and try to get them help. Because with treatment, you can accomplish the same thing, get to a point where they will come to realize that it never happened. But don't try to logically talk them out of it. They can also have disorganized speech. When you're talking to them, they jump from topic to topic. Their sentences are not coherent. They go from one topic, and next thing you know, you're talking about something completely different. They have very flattened affect. A young woman can stand there, a young man is walking by, his belt falls up, and his pants drop down, and you do not even see any emotion or any change in their affect. Things that will make you and I laugh, they will sit there and not even blink an eye. That is called flattened affect. They have impaired reasoning. Jobs that they used to be able to do, they're no longer able to have that ability to think about those issues. Their reasoning becomes very faulty, and they cannot solve problems very well. So it leads to occupational and social dysfunction, and these people really socially become very handicapped and very challenged. Well, the prevalence and the incidence is about 1% worldwide, and in all societies and cultures you see pretty much the same incidence. I've already mentioned that we tend to associate it with poverty, but who knows whether it's the isolation and not inability to do tasks and jobs that make them lose their jobs and become poor. And a lot of them are found to be single, which may also have to deal with their interpersonal relationships and the difficulties and challenges. Usually the age of onset is in the mid-20s. It's unusual to see it manifest in childhood. Most people have their initial episode of schizophrenic break in the early adulthood or in the early to mid-20s. 40% of males may have their first episode before age 20. So keep an eye on that age group. You know, it's the age where they have a lot of challenges. They're trying to find themselves. They compare themselves with their peers, and they may have a little bit of inability to do the things that some of their friends do. So there is also thoughts about the causes of this condition, and since we're able to treat it with some medications, we believe that there is some change in the chemistry of the brain. But you know, another very interesting thing is that we find that twins who are identical, sometimes the other twin has a 50% chance of having this same condition as the other twin. And we also find that if you have a first-degree relative who has this condition, there's usually a 10% increase in the risk that you may have it. So there may be some genetic predisposition to it. But I think there's a little bit more to it than that. Because we find that whenever there is famine and hunger and starvation, where during the 3rd to the 6th month of pregnancy, there is starvation and very poor nutrition, you see an uptick where people are born with more predisposition to having this condition. So there may be some development challenge in the brain, just like somebody who has polio, for example, and becomes lame. Maybe the formation of the brain whilst you are inside your mother's womb, there may be some missing nutrients, oxygen deprivation, your mother not getting enough nutrition to feed into the formation of the brain structure itself that can maybe predisposing these people to this condition. So we have to sympathize with them, because but for the grace of God, we could all end up like that. We also know that certain viral infections of the brain can sometimes cause this condition of schizophrenia. There are some environmental stressful conditions that may trigger this people who are already susceptible to schizophrenia. And one very important one that I like to emphasize is marijuana. Marijuana seems to be a trigger. And this is the age where schizophrenia starts. I already told you, around the 20-year group. So all that experimentation in that age group may bring this out. That's why a lot of them have their first episodes around that time. Alcohol is another culprit when it comes to this. What else happens in this age group? Some of them are leaving home for the first time, going to school away from their parents where they had that nurturing environment, and all the ambivalence and difficulties that come. That's why some people end up in high school for the first time with their chop boxes and everything, and before you know it, the parents are getting called to come back because your child is having problems. And of course, when you have a very deep romantic relationship and there's a breakup, sometimes that can also trigger schizophrenic episodes. So don't leave your loved ones hanging, and stay around and help them. Some of the symptoms actually and signs develop in an average of about 12 to 14 months before most people seek medical care, where they have impaired ability to function. But the signs and symptoms may be usually so subtle that it's only an afterthought that people say, I was working with this guy and he was becoming a little bit withdrawn and having some strange thoughts, and I thought it was just a phase that he was going through. But as things progress, these people become unemployed, they become isolated, and then they start having developmental problems. They may drop out of school, and because of that, they have very diminished quality of life. So it's very important that we identify these things very early, because actually there are phases that can be very easily identified that schizophrenic patients go through. There's a pre-morbid phase. The pre-morbid phase, for some people, there may not be any symptoms at all. For other people, there may be impaired social competence. So such people may, in a meeting, come up with ideas, and people will look at each other and say, where is he coming from with that? They may, because of such situations, start withdrawing themselves. Those who are prone to becoming manic may start showing some irritability, and the onset may be gradual. However, in most people, once they get to the prodromal phase, the break can happen very, very suddenly, especially if a loved one was to jail them, leave them suddenly, or if there's a sudden change in their social life at that time, or they go and experiment, God forbid, with alcohol or some drugs when they're going through this prodromal phase. Of course, we then identify a third phase, which we call the middle phase, when now the patient is a full-blown schizophrenic, and they become very symptomatic. They are hearing voices, they are having the delusions and the lack of reality. That's when a lot of people then are able to seek help. But you see, before that, they've gone through the pre-morbid phase, the prodromal phase, and in the late phase, it becomes a little bit more difficult to treat. Just as I told you about the people who were depressed, suicide is also very, very important among this group. On the average, this disorder reduces the person's lifespan by at least 10 years. 5 to 6% of patients with schizophrenia will commit suicide, and approximately 20% of them will attempt it, and a lot of them will have suicidal ideation and thoughts about killing themselves. The worst ones that you have to look out for are the ones who became schizophrenic later on in life, because they've tasted the good life. They know what it was to have a good life, and now all of a sudden they see themselves in this situation. Watch out, because it's when you think that they've actually gotten better, that's when they can kill themselves. I had the misfortune of having a mate in medical school whose dad, the father himself, was a doctor, a cardiologist in a very reputable hospital in Detroit, Michigan. He was the chairman of the Department of Heart Diseases. But you know what his problem was? He was the best student in his class in medical school, and he was depressed because some people who weren't even as good as he was in school had now written books, receiving awards, and achieving and accomplishing a lot more in life than he thought he had accomplished. You know, the week before, his doctor was thinking about putting him on medication. He told the doctor, "Oh, I'm a doctor, I'm fine. I've come to realize that that's just my lot in life." And so the medication was never prescribed. Do you know what? Monday morning, he was found hanging in his house. So be careful when somebody who is showing all the symptoms of schizophrenia all of a sudden reassures you that they've broken through, they're doing fine, and they don't need any help. That is when you have to be careful, because they can take their lives.